I'm Muhammad Randi, and today I'm going to talk about wearing surgical masks in public could help solve COVID-19 pandemic. So, ladies and gentlemen, the coronavirus, which began in Wuhan, China, and has now become a global issue with many countries. As there are no vaccine and medicine to prevent respiratory ailments, alternatives should be tried in anticipation. The chairman of the Indonesian Lung, Dr. Agus Dwi Susanto, SPPK, said that one of the prevention efforts to infect the coronavirus was with the use of masks. So, surgical masks are very common for protection from air pollution. But was it effective when applied to protect against exposure to the coronavirus? Indonesia's BBC use of surgical masks to prevent the transmission of disease is very popular in many countries of the world, especially in China. Since the coronavirus outbreak has become a global concern, this surgical mask or anti-pollution mask has been widely used in communities to protect themselves from exposure to the virus. Virology experts are skeptical about the effectiveness of the surgical mask on viruses in the air. There is evidence, however, that these masks can help prevent transmission from the hand to the mouth. The surgical masks were first introduced to hospitals in the late 18th century, but were not introduced directly to the public. After the surgical mask was introduced after a flu outbreak struck Spain in 1990, killing more than 50 million people. So, ladies and gentlemen, common surgical masks are not an effective protection against airborne virus or bacteria, said Dr. David Carrington of St. George's London University told BBC News, but Carrington said that mask was too loose and had no air sieve to protect the air of the eyes. However, such a surgical mask can help lower the risk of contracting a virus by splashing from sneezing or coughing, as well as by providing protection from hand-to-mouth infection. A study conducted in 2016 from New South Wales, Australia, found that people touch their face about 30 times in hour. In Hong Kong and Taiwan have been using universal masks to control the number of cases of spreading the coronavirus. Indications of the coronavirus may be airborne and may remain in the neighborhood as a result of respiratory droplets. Thus far, it has been regarded as a master model of transmission of the coronavirus. In a study in Singapore, traces of the virus were found in an air vent in the patient's isolation room. While other studies mention researchers at the University of Nebraska Medical Center have detected substantial contamination in the patient's room, as well as air samples gathered in room passengers. So, ladies and gentlemen, to prevent the spread of the coronavirus, in addition to the surgical mask, We can also make a fabric mask to prevent the spread of the virus. Scott Gottlieb, former Commissioner of the Food and Drug Administration, suggested that the CDC, Centers of Disease Control and Prevention, release special or standard design on cloth masks for the general public. Masks don't just serve to protect those who are sick, although they may offer protection, says Gottlieb. However, he felt that this cloth mask was used to protect people from those who were sick. So, when an affected person is wearing a mask, it is far more likely to transmit infection. In one study linking Gottlieb, wearing a mask reduced the ability of someone with the flu to pass it by about 50%. So, here's CDC or Centers for Disease Control and Prevention guidelines regarding the use of non-medical cloth masks to prevent the spread of the coronavirus. The words, if you are sick, when a mask is available, wear it while you are around others, including before you went to the health facility. And the second, if you are caring for others who are sick and cannot wear a face mask, then wear a mask when in the same room as them. And third, during a public health emergency, surgical masks may be available to health workers. The general public may use non-medical masks, such as cloth masks, or wear scarves for closure and mouth while at the airport. And the fourth, keep social distance, at least 2 meters in public space. So, ladies and gentlemen, these measures are necessary and must be met during the pandemic of coronavirus outbreak that has caused hundreds of thousands of people in the world to be infected with COVID-19 pandemic. So, again and again, remember to wear a cloth mask or surgical mask and always wash your hands if you are going to leave the house in order to reduce infection. So, thank you.